Hi there, Vitality Seekers. Dr. Corey Feldman here, and today I want to talk to you about a really common scenario that's really frustrating for many people, and some of you have probably experienced this as well. And that scenario is you get your labs drawn, you're told they're normal, but you don't feel normal. You don't feel great. In some cases, you feel terrible, and you definitely feel like something is off and not normal. This is really common, and I wanted to talk to you today about why this is happening so that you can arm yourself with better knowledge and really understand how you can get better information for yourself. And what I want you to understand is that when you get your labs drawn, let's use the example of Quest Diagnostics. That's a lab company that we use with my clinic. And when you go and you get your labs drawn with Quest, what happens is Quest will run the blood work. They will give the results back and put it in a report, and then they'll give ranges on the report that will tell you they're normal. What they're doing is they're giving you the average of the population that is actually getting their blood drawn at Quest. Now, if we think about that population, I want you to ask yourself, are majority of the people that are having labs drawn often through a place like Quest or a lot of other lab companies, are they in a healthier category, or do you think they're not as healthy? It kind of makes sense that if you're not having as good health for yourself, you're probably getting your labs drawn more. And so it's the average of the population that's actually not the most healthy. And so if you understand that part of it, it makes sense that you're told you're normal for that population. But I attract people like you that don't accept that and actually want to be optimal. And so, in order for you to figure out what ranges are going to be optimal for yourself, you need to find a practitioner that can help you know what those functional and optimal ranges are. So, a doctor or practitioner that practices functional medicine is the right place to go. Now, I want to give you a quick example of how this might be confusing. And an example would be a fasting blood sugar. A lot of times when we go to the primary care doctors, we get a fasting blood sugar included in our blood work. And if you look at the example, we're going to use Quest, since that's the company that we use the most. Quest will tell you that the fasting blood sugar level should be under 100. And if you're above 126, you're in the diabetes range. Okay, so it's like hard numbers like that. But here's the truth. If you want to be optimal with your blood sugar, you actually want the fasting blood sugar number to be less than 85. So if you're going along and thinking if you're at 99, you're actually really good, the truth is you're bordering on that pre-diabetes range. And again, this is what's happening to a lot of people that I attract, because all of a sudden they're told they have pre-diabetes or diabetes and they had no idea where it came from. Whereas this actually was brewing for years before that. So I want you to be really clear about why this is happening and arm you with the knowledge to go find a practitioner that will help you not only get the right testing, but also understand what your optimal ranges will be for you and your health goals. Now, I want to give you a little more information about the companies that are out there promoting 100 plus lab tests at once, for example. I'm not going to say any names, but there's a couple of them. And some people come to me with these packets full of these 100 plus test results. And again, you're going to have the same problem, whereas the ranges for these tests are all going to be the average of the population for the lab, not necessarily the optimal ranges. And what I found happens is you often get a lot of information that you don't need. And in a lot of cases, it's going to make you nervous and anxious about things that in some cases you can't even change. So I would encourage you not to do that shotgun testing approach. And again, to find a practitioner that will be strategic with you and help you narrow down what lab tests are most helpful and important for you and your health goals. And then, of course, as I mentioned earlier, help you figure out what your optimal ranges are going to be for those lab tests. So I hope that's helpful and makes sense. Stay tuned for more tips on how to heal and extend your health span.